$140 billion. That's how much medical debt is dangling over adults in the U.S. It's the largest source of personal debt weighing down households. New research from the Peterson Center on Healthcare and the Kaiser Family Foundation shows even though 90% of adults have some form of health insurance, medical debt is still a problem, and it's setting them up for higher risks of eviction, food insecurity, and bad health outcomes, regardless of insurance or income. So let's bring in Wes Yin, professor of management and public policy at UCLA. Thank you, Wes, for being with us. What would you say are the key factors? What are the largest contributors to medical debt in America?
Hi, Adrienne. Thanks for having me on your show. Well, I think most immediately, it's the lack of health insurance. Medical debt has actually dramatically decreased after Medicaid expansion under Obamacare. But it's worsened in the 12 states that haven't. But it's not just the uninsured who accrue medical debt, as you mentioned. It's also the underinsured. Nearly 45% of Americans with employer-sponsored insurance have deductibles that exceed $2,000, and that leaves Americans vulnerable to medical expenses and debt. But I'd also take a step back. Medical debt is a problem in and of itself, but it's also a symptom of deeper problems. Over the past 40 years, GDP and labor productivity have experienced robust growth, but wage growth has been flat, and this has eroded workers' abilities to buy decent insurance. And therefore, people increasingly rely on publicly funded insurance and subsidies, but even that's not enough.
How do policies come into play when it comes to a look at our healthcare system and how much it needs to change, and in terms of helping people to have more affordable healthcare and tackle debt?
Yeah, I view it in steps. Most immediately, for example, the recent White House actions to limit how medical debt impacts the federal loan rates and eligibility, and offering new oversights over collection practices. Those are all great first steps. This is tackling medical debt at its source. This can also be expanded to limit how medical debt impacts consumer credit reports more generally. Maybe also creating stronger oversights over abusive collections practices. But I think, more holistically, expanding health insurance is important, including expanding Medicaid in the 12 holdout states, and making permanent Obamacare marketplace subsidies, which the Inflation Reduction Act passed for 3 years, but that could be made more permanent. But I also think, we need to take seriously more of the systemic problems that we mentioned earlier. The problems of diminished wage growth, anti-competitive pricing in healthcare. These are all things that contribute more holistically to the medical debt problem in the first place.
And one more question for you. What advice do you have for anybody who has a lot of medical debt right now, especially if they're already feeling like they're underwater?
Yeah, absolutely. I think the first thing is there are certain charities that help out with medical debt abolishment. For example, a collaborator of ours, RIP Medical Debt, is a wonderful organization that might be able to assist individuals. But the hospitals themselves might have different strategies to limit the amount of debt that they owe. In fact, they might be eligible for reduced payments or even no payments, depending on their incomes. And individuals might not be aware of that. And sometimes it's difficult to know what they can avail of. But hospitals often have these programs, and they should look into that.
Yes, and there are different resources available for people who are in debt to try to get some of that reduced and settle it, because one of the biggest businesses right now is collection agencies who purchase people's debt just so that the payer, the original payer or payee, could actually settle it. Thank you so much, Wes Yin, for being with us. We appreciate it.
Thanks, Adrienne.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.